Okay, today is Wednesday, October 10th, 2018. My name is Edna Sussman. I'm a reference librarian here at the Half Hollow Hills Community Library. We're interviewing Dr. Irwin J Nelson, a Vietnam Army veteran, as part of our Veterans Testimonial Project and in collaboration with the Library of Congress's Veterans History Project. Thank you so much, Dr. Nelson, for your service and participating in our project today. Dr. Nelson, where and when were you born?
I was born in Brooklyn, New York in July of 1934.
July what date?
26th, 1934.
And who were your parents and what were their occupations? What were their names and occupations?
My father's name was Lewis Nelson. He was an orthopedic surgeon. Mm-hmm. And my mother's name was Stell. Her maiden name was Jarofsky. And she had been a part-time lawyer, but then she was a full-time housewife.
Ah. And did you have any siblings?
I have two sisters.
What were their names? Did they serve in the military at all?
No.
And what were their names?
The oldest sister is Harriet Nelson, and Myra Nelson, who was 7 years younger than I.
Uh-huh.
But so, she's no longer living. She died complications of plastic surgery.
Oh, sorry. So you were the middle.
Middle child.
What were you doing before you entered the service?
I had just completed my orthopedic residency training. That was after 4 years. The year I remember like it was just yesterday.
Really?
It was 1964 June. I had finished my 4 years of training. And I went down to my draft board in Brooklyn, and I told them I was just finishing my residency. What should I do in terms of going out to practice, or was I going to be drafted? The Vietnam War had already been on for like 2 years. So when I went down to the draft board, they said, "Oh, Dr. Nelson, we have so many doctors from the Berry program, you don't have to worry." I said, "What do you mean?" Well, in 1961, there was the Berlin crisis, and they had what they called the Berry program, where doctors could enlist into the Berry program, which would promise them that they would finish their 4 years of residency, and after they finished their residency, they then had to go into either the Army, the Navy, whatever they had agreed to.
You mean they would not draft them during those 4 years?
Exactly.
That was the agreement?
Exactly. That was in 1960. So a lot of the doctors in 62, 63, 64 all agreed to join the Berry program. Mm-hmm. So I said, "Well, then you don't think it's likely that I'll be drafted?" They said, "No, not at all. We have so many other orthopedists signed up from the Berry program." So I had decided that I was going to open up a practice in Brooklyn. And I went ahead and I rented an office, and I had to fix it up. I built an x-ray room. I furnished it. I spent considerable sums of money. And I opened up an office, and I went into practice. And I went into practice in September, and I was very excited. And everything was going fine for 5 months. And then I'll never forget it. It was February.
Was it 64?
Now we're 65. February of 65. I get a letter, "Greetings, I've been drafted." Oh. And I was given 10 days notice.
Oh my God.
To appear at Fort Sam for training to get ready that I was going to go overseas within about 30 days to Vietnam.
Unbelievable.
There I was. I just had an office. I was just getting started. I had patience. I said, "How could I do this in 10 days' notice?" They said, "Listen, you got your orders. We expect you there."
Oh my.
Which, incidentally, I told that was not the correct information. They could have given me another month, and it really wasn't true. But this is what I was told, and that's what I did. I didn't know any different. So it broke my lease, and I didn't have to pay any more rent. But I was out all that money that I had for fixing up an office
and
building an x-ray room. Well, that I was put in storage. That's the Army came, they wrapped it up, they put it in storage for me. But anyway.
Did you have a family then? Were you?
I was about 32 years old at that time. I had a wife. I had 2 children.
Oh, wow.
And I had to do my duty. I got called up. What am I supposed to do? So the problem was I was given 10 days to wrap this all up. But we managed to do it, and whatever had to be done afterwards, thank goodness I had a capable wife, and she took care of whatever had to be done, alerting the patients, collecting whatever bills I had, paying whatever I had to do. And I go to Fort Sam.
Where is that?
Fort Sam is in San Antonio, Texas.
Well, why'd they send you so far for that? I mean, are there a lot
That is where most physicians or most offices, you go for training for 2 months to learn, how to signal, how to study, how to do all things. You come in a captain in the Army, and you're expected to know certain basic military rules, regulations, and whatnot. So they send most people to 2 weeks for basic training in Fort Sam.
I see.
For the average person, they're training how to shoot. They're training, basic training, you crawl under barbed wire.
Did you have to do that?
And, well, funny you should mention that. The group of doctors that I was drafted in off of this 10 days notice, there was this sudden buildup in Vietnam, and they were getting very rapidly a lot of casualties. And they wanted ready, trained doctors.
That's why they wanted.
So what happened is the average age of the doctors that they took in my group, now I was 32, some of them were as old as 34. But you can't take, particularly physicians who are non-athletic, who've been sitting and studying, basically sedentary. Some of them really out of shape. They may be smart intellectually, but physically not so good. So they took us to Fort Sam, and after a week of having us try to crawl under barbed wire, where one doctor had a heart attack, another one I never forget, they're shooting live ammunition over us, and one of the doctors stands up, and they scream at him, "Why did you stand up?" He says, "I saw a snake."
Oh, jeez.
So finally, they had so many little incidences with the doctors that they said, "You know what? You guys are all going to Vietnam, no matter what."
Wow.
So they actually stopped our basic training. And what was so crazy, this was now, I remember it was March, very beginning of March in San Antonio. They never get snow in San Antonio. That year, it snowed.
You're kidding.
It snowed. We had 5-6 inches of snow. Just the week we were supposed to go out and bivouac. They would teach us how to be doctors, how to be dropped off somewhere, give a compass. They said we were going to get lost. We were going to have such tragedies that they said, "You know what? Forget it." And they basically
Sent you abroad right away?
Well, no. Remember, this group, we were all drafted on 10 days' notice. We had to go. It was immediate. All right, so we go to Fort Sam. After Fort Sam, we go and we get our orders. And we were all supposed to be deployed immediately to Vietnam. That's why they did it on 10 days' notice.
Right.
Change. We were all going to be, most of this group, they were all going to form a 12th Vac hospital. And they were going to have us, they decided to send us over as a unit. So instead of sending us to Vietnam directly, flying us over, they sent us to Fort Ord in California. And they said we were supposed to be going to Fort Ord for about a month. They wanted to get the average hospital units, the preparations of everything that they were going to do, and ship doctors, nurses, corpsmen, all the support, along with all the equipment. And now we were going to go by ship rather than by plane, which would be very expensive to support all the support.
But quicker, would have been
So
quicker.
they were going to send us over. All right, so we're going to stay in Fort Ord for approximately a month, and then we're going to go to Vietnam. I'm bringing this up because I want you to know how unfair certain things are in the Army. I was an officer, and financially I was able to do it, so I said to my wife, "Hey, you know what? We're going to be in Fort Ord for at least a month or 2. Why don't you fly out with the kids, just pack your suitcases and come?" I had 2 young children. They were like 4 and 2 at the time. So they could just pick up. There was no issues with schooling.
Right.
So she said, okay, and she came, and we were going to stay. Well, I don't want to drag out the story. We ended up staying at Fort Ord for 6.5 months.
You're kidding. Why?
One delay after the other until they were finally able to get the unit together was like the usual story. We found that hurry up and wait. And I mention this because it was so unfair, because at most you were supposed to be away from your family for a year, the year you go to Vietnam. And truthfully, we all went to Vietnam, and we were there for a year, full year to the date. But the enlisted men and all the other people were there. They were spent actually first 6.5 months in Fort Ord, and then they were shipped over for a full year. So they were away from their families for like a year and 6 months.
Yeah.
I mean, for me, it was just a year.
Yeah.
But I just want you to know, everything isn't really fair and square.
But the 6 months you spent there,
Well,
was
then I was a doctor at Fort Ord.
Oh,
Remember,
okay.
so even though I was in the Army, I was still practicing orthopedics. I would still have
I see.
clinics. I was still acting doing work as a physician. In fact, I was operating on some of the civilians that I went over to. They had time at the VA hospital also.
So that went towards your year, the 6 months?
That went to my 2 years. And it was when you're drafted, you're allowed, it's 2 years, and it was supposed to be 1 year in Vietnam
I see.
and 1 year back. But because it took 6 months, actually almost 7 months, it was broken up. It wasn't one, like it was 1 year here and 1 year there. It was broken into pieces. But then the unit went, first we went to Quy Nhon we were there about a month, and then I was working as a doctor there. There I was helping the doctors there was like a fixed hospital unit. And operating in a building, but there they had not only the Americans and the South Vietnamese, at that time they had the Korean unit, their crack Korean units, and they were really very well trained.
Doctors,
but
Korean
we were
doctors.
taking care of the Korean soldiers there as well. This was in Quy Nhon, which is near a seaport. Then finally they had built up the area, and the 12th Evac hospital was built, and this was stationed in Cu Chi. Cu Chi is about 20 miles from the Cambodian border.
I see.
And now we're in the year of 1965, almost 6, right? 65, 66. And it was a hot, heated battle, was full-blown. I mean, I don't know how this tape is going to go, but, we're from the Cambodian. We're taking in all these casualties. And the President of the United States is on television saying, we are not in Cambodia. And there we are operating on all these poor souls that were coming in. And, I don't want to be, war is war. And it doesn't make a difference what war it is it's held. But as long as you're interviewing me, there are a few things I would like to say that I learned about from my experience, which I probably never ever had. One was when I was in Vietnam, it wasn't a shooting war. It was the kind of war where the soldiers would go out in these personnel carriers and go out at night, and they'd just be blown up. So when they came in, they had 2 legs blown off. They had an arm it was horrendous war wounds. I mean, they weren't just like bullet wounds. So very quickly, there was a type of surgery there that I suddenly had to do.
I was going to ask you, how do you learn that so quickly? You didn't learn that in...
Well, you in civilian life, you never, ever, ever see the kind of wounds, thank God. I mean, people have their both legs blown off and their pelvis is open. You're looking and you're seeing their entire pelvis. Wow. I don't want to get gory, but so it was an educational, surgical experience for me, but it was horrible knowing that you're looking at these 17, 18, 19-year-old boys with their extremities being blown off and they're...
Terrible.
It was a terrible experience. It's a kind of experience that, truthfully, as I told you before I gave you this interview, I just did not speak about Vietnam. I could not speak about Vietnam because of the unfairness of it, the futility of it. But now I'm here, I'm relaxed, I don't mind sharing some things with you.
Yeah, thank you.
I will tell you, it was a learning experience for me, not from just the medical point of view, but I learned a valuable lesson that I think enhanced me going on into the future. I was most impressed, and I say this in honesty, with the quality and the care of the people who were trained to be medical personnel and assistants.
Well, that's nice.
They took their job seriously. It was important to them, and they were really very diligent in their work. The
Dedicated.
doctors, we were there because we were drafted and we had to be there, and we just couldn't wait to do what we had to do and get finished and get home.
Yeah. Well, that's
But
good to
I will
hear.
tell you, the
Wow.
corpsmen were wonderful, and when I had to do surgery, I preferred having corpsmen assist me than medical doctors per se, who really didn't care what they were doing. They were just there because they had to do it. But I found out that if I trained them, they would do it, and they took pride in what they did, and they were wonderful assistants, so that I learned later on when I became practice, I learned to take technicians and train them, and I used them later on. I was no longer afraid to delegate certain responsibilities, because at one time, you're always trained if you want it done right, you have to do it yourself.
Right.
And that's not really true. And the one thing the Army tells you, if you get qualified people, and you learn to delegate responsibility, you can do a hell of a lot more.
That's very interesting to hear. That's good.
And that was, I think, that was the one most valuable lesson that I got out of that 2 years, to be honest. It was 2 years of hell.
How do you feel adapting to military life? I mean, you kind of eased into it because you had 7 months.
You know what? That's not important. Everybody gets used to it. So, I mean, what's the big deal? The food is completely different kind of food. It was a completely different kind of everything. But that's not important I don't think, in an interview. I will tell you that every surgery that was done, it was never one procedure. Remember, it was high weapon missile fire and whatnot. So every wound had to be debrided. So if I say debrided, you go back in, you first clean out the wound. Remember, some of them have been laying in the field for a day or two after being so badly wounded because they couldn't come in to get them, to rescue them.
I see.
So some of them have been laying there in a dirty field, dirty grass, and so they came in, these wounds were all contaminated. So you'd bring them in, of course, you'd clean up the wounds the first time, debride as much of the dead tissue that you could, but then you didn't close these wounds and like you would in surgery. You would wait 4 or 5 days, go back again, then look to see whatever kind of tissues that you could, free up, because a lot of it was first would show up later that it was actually had been damaged.
Oh, I see.
So you couldn't always see it right away. So every operation was really 2. So if they brought in 10 soldiers and you had 10 wounds, you'd have to bring them back to the operating room. Excuse me.
You want some water?
No, I'm fine. Twice.
It's amazing that some could survive these injuries. How do you survive an injury?
The average, it's amazing when you think about that, 18, 19, 20 years old. And if you can get rid of the dead tissue and clean the wound, the ability for the body to recover at that age is amazing. But you must understand, these are not little wounds. I mean, most of them ended up with amputations. Most of them ended with horrendous, being maimed for life.
Wow.
And a lot of them, when they would come in with these wounds, they would want please shoot me.
Oh.
Do you know what it's like to have somebody come in with, his legs are blown up from the thighs down.
Terrible.
And sometimes his genitals are gone also. And he says, and if he's married, has a family or whatnot, he doesn't want to go home.
Yeah.
Please kill me, doctor. They don't really want
What
to
do you
be
say
there.
to someone like that? How do you deal with that? That must have been very, very hard.
Well, it sounds very callous to say that, but sometimes you just don't answer their question. You're so busy at the time, and you have things to do, and I guess I never felt I was a psychiatrist. You have a certain amount of compassion, but you can't dwell on it. You just can't do it. You just have to move on to the next patient and whatnot.
I guess it's good as a physician you take an oath, and your goal is to save people's lives, so that's what you do. I mean,
yes, you
that
do.
mentality has to always be there.
You do, and I'll tell you, I think I did a wonderful. I was the chief of the orthopedics, so I was not only did my job, I had to do, extra work in time of supervising the other orthopedists, as well as making things that are done. So there's a lot of things that involve in running a hospital and whatnot, scheduling that you think it's not. There's a lot of other work other than non-medical, which because I was so lucky to be the chief that I had to do all this extra work.
Wow.
But you talk about attitudes. I mean, I could sit here now, these so many years later, and sometimes be ashamed of some of the thoughts that I had. In other words, we would take care of the Americans first, and then we would take care if there were any South Vietnamese soldiers that got killed. And then don't forget, they would bring in sometimes Viet Cong prisoners
That were injured.
Shot the same way, badly hurt. And of course, in the triage, they would get the last ones to be fixed, but many of them survived. And then I would have to go in and operate on them. And and I could say, when you're tired, you're going 3-4 days straight. Say, what do you bring them in? What you bring here? Shoot them. How could you say that? These were people now that you sit back. They were people, human beings who were doing what they felt was right, fighting off the American aggressors. And they certainly believed a lot more in what they were doing than what we were doing there. We were doing that because we had to be there. We had to do a job. And
that must have been hard.
All war is hell.
Very
but this particular war, I think in World War II, you felt where you're fighting for democracy against horrible Nazism and whatnot.
Right.
Vietnam, the average person there, they couldn't care less whether you called them communists or Arvan or whatnot. They were just being jelly bombed and on both sides. I mean, when the Viet Cong would come into a village and cut off the arms of the children because the people were cooperating with the South Vietnamese government instead of becoming Viet Cong. I mean, you can't beat people like that. And these people aren't animals. They were doing what they had to do to win a war, and they won the war. There's no question. With all our equipment, with everything else, the Americans were defeated in that war. It's very hard for them to say so, but we're very arrogant as a country. The French tried it. The French got them whipped. We said, oh, we can do it. Didn't happen. And look how arrogant we were. The Russians lost in Afghanistan. They couldn't beat the Afghans back. And then we said, oh, we can do it. Same problem. We're basically being whipped there. We're changing the hearts and minds of people.
No.
We can kill more people, and we can say we're winning the war because we're killing the local population, but can't change the hearts and minds of people. I don't know what else you would like me to say.
So, little interest things that, like staying in touch with family and friends, were you able to do that? Was there mail at the time? I mean, you were in...
Well, no. At that time, there was ham operators.
Oh.
So I could call somewhere in the ham operator would maybe pick you up in California, and you would say up and over, and they would connect you by phone from the ham operator to maybe my wife, who was in New York at the time. But we didn't. I didn't really do that. The one time I remember calling home as Coochie got mortared where we were, and when you watch what was going on television, they showed the destruction that we got, even though we were a hospital. For most of the part, the Viet Cong did not mortar the hospital, because remember, I told we were taking care of the Vietnamese, the Viet Cong too.
And they knew that.
Yeah. And they knew that. So for a while, they let us go until things got pretty bad. Then one time they tried to overrun the hospital, the whole area. It was a complex, so you had helicopters and army and units and whatnot. So you would find that same day the barber that cut your hair in the barber shop in the PX there was found dead in his black pajamas at the fence. I mean, this was the kind of war that you didn't know who was like. It was like if we had a civil war in this country between Democrats and Republicans. Can you tell by looking at them who's a Democrat, who's a Republican? You can't. And this is what it was.
Well, I wondered, how do you differentiate between North and South Koreans when they came to the hospital? I mean, you didn't. You treated them all, but how do you know once they maybe get better that they don't turn on you?
You don't. You don't.
So
You don't.
once they're a little better from being medically taken care of, then what happened to them? The
Well, then they
North
would
Vietnamese.
be, you know what, I never really followed, I really don't want to say, because I really don't know what
Okay.
happened to them. They would be taken somewhere else, but that was no longer my concern. My concern was basically take care of American troops.
I mean, you had also troops there protecting the
Oh,
hospital.
yeah, we had, so, right, there was
Yeah.
gone, and, I mean, it wasn't constant battle.
Mm-hmm.
I mean, there'd be like 3 weeks I had no casualties, and then they would go out and do what they do, then they would bring in, so when it happened, you'd work like 3 weeks at a time,
Mm-hmm.
but then there'd be a lull for maybe 3-4 weeks.
How do you get supplies when you're in the middle? Were you like in a
Everything is
jungle?
brought in. Yeah, we're in the middle. It's like an outpost, like the fort with the Indians on the outside.
Yeah.
But everything came in from helicopter. I mean, that Vietnam was strictly a helicopter war. Everything was brought in, and except for the recovery room, everything was intense. We operated on intense,
What if didn't it get cold? I mean, was it always hot?
always hot.
Oh, it was
It could get
always
as hot
hot.
as 102, 101. I remember I did get an R&R. I met my wife in Hawaii,
Oh.
and it was 78, and she couldn't believe I'm walking around freezing and shaking all the time.
How long were you there, and how long R&R did you get?
You get 6 days,
Oh, okay.
and 1 day flying, so 7 days. But I was able to meet her in Hawaii.
How long a trip is that?
Who don't remember? It was a long flight.
Long flight, yeah.
Long flight. But it shows you get acclimatized. So when it's 102 day in, the only place that had air conditioning was the ICU and the recovery room.
The operating room not?
No, not really. And you talk about the operating room today, they're so concerned about being immaculate and clean
Yeah.
and scrubbing. We're operating on dirt floors.
Wow. God.
So,
What about bugs and things?
well,
You know?
the point is, if you're doing surgery, believe it or not, if you surgically clean a wound and you're dealing with young people with good circulation, that the ability for them to fight off infection is wonderful. But, there are certain things that's very hard to change. In civilian life, if you ever get a start, you get tetanus, you panic, oh my God, there's going to be gas gangrene. These people, a lot of them are laying in the field for 2-3 days. The field that they're laying in is with night soil and everything else. So all their wounds are contaminated.
Wow.
And when you do a smear and you see this tetanus there, you say, oh my God. But the fact that it's there doesn't mean they have tetanus.
Oh, huh.
So the bacteria there, but after you surgically clean the wounds and get rid of all the dead tissue, then they're able to combat it, and they do okay.
How do you, as a doctor there, how do you stay well and not get any, I mean, you must have gotten shots before you went over, or no? Did you get shots against certain diseases over there?
I don't think we had to get shots, but we had to take quinine against malaria.
Like regularly when you were there?
Yeah.
Or just
We-
one
we
shot?
took- No. We would take quinine pills.
Oh, I see.
We were given quinine pills so we shouldn't get malaria. If we had gotten shots, I really just don't remember. We're talking now
Yeah, it's a
a
while.
long time. So rather than say something that I don't really remember, I just say I just don't remember.
Yeah, but you didn't get sick when you were over there?
I did.
You did?
When I came home, I had no. I went into the Army weighing close to 200 pounds. When I came home, I was like 165 pounds.
You're kidding.
My wife
Wow.
didn't even recognize me.
Really? That was because of the food, or just the stress, or why?
Well, I just think it was long hours, and my immune system obviously got weakened because I had gotten mono at the end,
Oh.
and then I had also I got jaundice of the liver because hepatitis, because it affected it. So when I got out of the Army, I was sent to now Fort Monmouth, but when I got there, they discovered that I was really sick. So I was sick there for about 3-4 weeks, and remember, I only had like 3 months of my 4 months to the year before I was discharged,
Okay.
because of that delay in between. But I will tell you a story that I never, ever forgot. I was due to leave Vietnam in September.
66, 7?
It was now September of 67. I was supposed to leave Vietnam.
Okay.
So here it is, August of 67, and I'm looking forward. I'm called 1 month short. And do you remember what happened in August of 67?
No.
War broke out in Israel. There was the
yeah.
Israeli War
I
of
thought you meant it.
67.
Yeah.
And I don't have to tell you how rumors go in the Army that everybody is now frozen and nobody is able to leave it to go back to stateside. And we're all going to have to be here for an extended period of time, and no one knows why. But I'm short. I only have 1 month to go.
Why did they say that? I mean, those two are not related, Vietnam and Israel. I mean,
Well, if you're in the Army and they have to put resources somewhere and they're taking new people, they didn't know where they were going to have to go. But luckily, it was a 6-day war, 7-day war, and it didn't affect anything. But, with the Army, the rumors always fly. They always say, what is it? Don't believe anything you hear,
Really?
only half of what you see.
wow.
So
You think but they didn't send Americans to Israel for that? The Israelis took care of it.
No,
Yeah.
no. That was a 7-day war. It was quick, but in the meantime, it was just the rumors. They
Sure.
go, oh, look, there's going to be another war, and everybody's going to be frozen. They're not going to be using their resources to ship people home.
Wow.
But that was nonsense.
When you came back, so when you spent 3 weeks in the hospital then, getting better, then you went back home and started your practice again, or what happened?
No. What happened then is, well, I was a little not quite
Needed to recover.
And I was, it's so hard now to explain the culture at that time, and I don't want to sound down per se, but the questions, we were in a group, people were, instead of giving any kind of sympathy to my wife when I was over there, how come he didn't run off and go to Canada? I'm an American, I felt responsible. I would never think of doing something like that. But the people resented what was going on in Vietnam, and they resented the people who were going over there.
Sure.
I mean, I didn't ever go there, and I never shot anybody, and I never hurt anybody. In fact, I helped, but
A lot of people.
but there was a lot of, hatred and a lot of anyway, to make a long story short, I got a job for 1 year. I went in with another physician, and then I realized that I really wanted to be solo on myself. So then afterwards, after I went out, I got the stuff that was put in storage out from storage, and I again did the process
Started up
over again. I
Yeah.
started again,
Oh, good for
and then
you.
I did do that again. However, I don't think anything else that I would say is different than any other basic soldier that was there in Vietnam.
Well, the medical part's very interesting, very interesting. But so how do you think you said your military experience helped you when you had your own practice and you had to train or delegate work? Are there any other experiences you had in the military that affected your life? Is that not a kosher question?
Well, I think if I'm doing an interview, I'd just rather.
Okay.
Of course, it affects you. You're away from your family. You are upset that things have happened and that the inequalities are there, where some people are going out spending their 2 years in the Army water skiing somewhere in Hawaii, and you're spending all this time doing all this horrible. And every physician has different experiences, even within the group. Certain doctors, they tried to do as little as they possibly could because they were medical doctors, and there wasn't that much medicine to do.
It was mainly surgery that
It was mainly all surgery. Even within the surgery, everything that was there, because of the kind of injuries that were there, was really orthopedics.
Really?
Right.
Well, so what if someone came in and had, chest injuries and I don't
Well, we had a thoracic surgeon
Oh,
with us.
okay.
They would do the chest.
Okay.
Many patients
Like
we would
heart
operate
issues or-
together. And he would be operating on the belly, and I may be working on a leg or an ankle or a foot
At
or
the same
something.
time?
At the same time, we would
Really?
team up, yes.
Wow. How do you think your military service impacted your feelings about war and the military in general?
I'm not going to go
Okay,
there.
we won't go there.
I'm not going to go there.
Is there a message you'd like to leave for future generations who might view this interview?
Yes, I think all wars are hell. And I will tell you that if you're going to subject your people to the kind of war where they're losing their arms and their legs, then you should fight a war to win it, and not to do what we did in Vietnam, where these soldiers were just going out, being blown up, and getting hurt. And it wasn't even a kind of fighting war. It was a senseless war.
It was long, too.
It was a long, senseless war. And if our people are in government, I really think they should be willing to send any war we have, I think they should be willing to put their children in the war, not a selective war. It was a selective war.
Why do you say that?
Well, anybody who went to college or had any kind of wealth was always able to do something and get out of the draft. Remember, mine was a doctor's draft.
Okay.
It was completely different. Most people are drafted and they had a number and they went in, but it was basically, if you were going to college or at any kind, you were able to get a deferment, you were able to get out of it, and most of them didn't do it.
You didn't have a choice,
No.
but with the branch, too. I mean, there must have been physicians needed for the other branches, too. How come, I mean, you could, when the Army came to you, you couldn't have said, well, I want to join the Navy. There wasn't a choice.
If I had voluntarily went to the Navy and said, I'm going to go and I would like to go into the Navy, and probably I could enlist in the Navy or I could enlist in the Air Force.
Oh,
However, many of the time I could have done that and I would go in as a major, but I would have to give them another year.
oh, I see.
Remember, they counted ages. I was not just out of residency.
Right.
So I had already been, so they actually theoretically would have given me credit for my years in practice.
Really?
Yeah, so I could have gone, if they gave me a deal where I could go to Germany for 3 years, and I would have gone in as a major and stayed for 3 years. But I didn't want to. I wanted to do my 2 years, do my duty, and get out.
Well, that's really admirable, because you knew probably, saying you were going to do those 2 years, that you were going to be sent to Vietnam, right?
Yeah, oh, I knew that. I knew that, yeah.
Weren't you afraid? I guess as a physician, you're usually in a safer place.
Well, when you say afraid, the only time we ever had was when we were mortared. Sure, you're afraid when the mortars are coming in.
How do you protect yourself? I mean,
You hide. You go into a trench where there are sandbags, and you put your head down and you wait till the shelling stops.
Wow. Anything else we haven't discussed or addressed that you'd like to cover?
I don't think so.
Okay.
I'm glad I came back.
We
I
are
was
too.
able to have a good life, and as I said, I don't think I was able to. I never would have been willing to discuss this until just recently. Now I'm able to sit back with some old veteran, and it's interesting when I talk to them. They also, Vietnam soldiers only talk about Vietnam to fellow Vietnam.
I'm honored that you'd share with us.
Yeah, because it's not a kind of war that we were all proud of.
Well, we're
Really.
grateful for your service and for sharing with us. 'Cause I'm sure it's not easy to talk about, and we really appreciate it.
Thank you.
Thank
So I
you.
guess we can end the interview now.
We're good. Thank you so much.
Right. Thank you. I hope I said what I wanted to.